Guru Nation, I'm here with a very special guest, Claire. She's an experienced study coordinator. Now she's a coordinator for an oncology and multi-specialty clinic. I'm actually her monitor, and we're also the CRO that's running one of the studies, but I'm her monitor for a couple studies, actually. So we're going to be working a lot with this young lady over the next years.
Sure.
God willing,
I look
right?
forward to that.
God willing. So Claire, give us a background on who you are, how you got started in research, because people watching right now, they want to be in your position, but how did they get there? How did you get there?
I started as a research assistant, preparing the source document before every visit. So I was like research assistant for a CRC. And then I worked my way up. After that, I assumed the position of doing the regulatory.
So you were an assistant. So how did you get that job? Because people are like, okay, Claire, sounds good. But how did you get that?
It's just so happened to have that I was looking for like a general position. And then, so I got a job at a dedicated research site. So that's basically what they asked me to do. So, and who knows, it's the right path for me. So from there on, I moved on to different phases of being in clinical research.
And what was your background? Like, I don't know if you mentioned already, but
Okay. Actually, my background is, I don't have a science background. My background is, I have a degree in business management.
Ah, very good. A lot of viewers have the same degree.
Yeah.
So it makes them happy.
So being a research coordinator, I learned it through experience. And so I just went by that. So I learned every phase, like if it's regulatory, I learned it. Contract and budget, I learned it. I guess I was lucky to have really good mentors.
Yeah.
So that's how I learned.
And now you have a really good PI, Dr. Al. He's amazing, very hands-on, very much involved. And now you're learning oncology. So you were doing psychiatric trials, then general medicine, multi-therapeutic. Now you're doing oncology and all those other things we mentioned.
True.
Right?
Yes.
At a newer site. So what has been your challenges so far and your experiences so far? How long have you been at this site?
It's just a few months, less than 6 months.
So what do you like it?
So far, yes. That's a lot of learning.
Yeah.
And the challenge for me is switching from other therapeutic areas to oncology because how they run oncology is quite different.
Yeah, it's like another language.
It is.
Quick advice for people wanting to learn oncology. What did Dr. Al tell you is like the Bible? What did he say?
It's the Bible is the
CTCAE.
Yeah,
I think.
CTCAE.
Version 5 is the most recent one as of October 2019.
That's true. So Dr. Al said that treat this as your Bible. So I have it on my laptop. So
And anyone can download this. It's free too, right?
And so aside from the challenge really is combining standard of care with clinical research.
That's right, because oncology is very much blurs those lines.
True.
Very much. And matter of fact, in some oncology studies, patients' insurance still get billed, even if they're in a study, which is unheard of in most studies.
Or sometimes it gets denied, so
we had
that's
a patient
another
where that
challenge
happened.
too. Yes.
Yeah, so a lot of different challenges, but you're learning all aspects now. And now that you have oncology, it's really good for your background, obviously. We're going to do more videos with Claire as the months progress. So far, any monitors besides me here?
No, just you.
Okay.
We had a lot of, we had 3 site visits.
Okay.
And a lot of visits from medical liaisons from
Oh,
different
good. And right now, Dr. Al is at Magi networking for studies. So good. Well, thank you very much, Claire. Thank you for sharing your advice for Guru Nation, and we'll be following up with you as the months progress. Okay. Thank you, everybody. Bye bye. Just wrapped up a IMV too with the students.
Really good.
We got a lot of students. What do you guys think as we leave? You still want to be CRA?
Absolutely.
Right away? Tomorrow? You want to get hired tomorrow?
And then we are all
Yeah, I'm ready to get hired tomorrow.
Good.
we are all following our lead CRA in the
I
front.
know.
I'm already hired.
She's walking with all confidence, majestically.
So what do you guys think? Good? Good? You feel confident?
I
It's
learned
been a
so
very
much.
good experience. Thank you so much, Dan.
Exponentially.
Thank you
I
so
don't
much,
think I would
Chris.
have ever learned this much if I hadn't come.
It's
Really?
It's
Yes.
a good thing.
Very
you
good.
came.
I have a question for these two.
Is it-
Because you both, like 2 hours ago, said you wanted to be a CRC first. And now, and 2 hours later, you're both ready tomorrow to be a CRA.
If I
Because
get
you
a chance,
convinced us
if I get
that
a chance to be a CRA, I would be. It would
Yeah?
be
you
great
convinced
for
us that
me.
it was all this fear.
Yeah, and I agree. It is fear, mostly. Mostly.
Don't be afraid.
I think I'm convinced after 2 or 3
But
visits.
the best
we will.
CRAs were a coordinator at one time.
Yes.
Really? Okay. That's
Yes.
what you keep saying.
Whatever
That's
we
true.
find first, CRC or CRA.
Okay.
It's good to
Either is
start.
good.
Yeah.
You'll
Either
take
is
whatever comes first.
Yes.
Yes.
Mount
Okay.
Sinai, Mount Sinai,
Yes.
someplace in Atlanta.
Yes, someplace biotechnical.
And then
Bioclinical.
for Judith, anywhere. The sky's the limit.
Yes.
No, the sky is the beginning.
The sky's the
Uh-oh.
you like
Talk
like
about
that.
confidence now.
It's a smoky sky.
Talk about confidence. That's all
We're
right.
going down, right?
All right, thank you guys. Excellent CRA Academy. Till next time.